Hi, my name is Katie Koehler, and I'm a student in the University of Michigan School of Nursing. Today I'll be reporting the assessment of a patient from clinical at the VA. Mr. Smith is an 86-year-old white male who was born on June 22, 1927 in Warren, Michigan. He lived with his two parents and was the oldest of three other siblings. He was in the Army for many years and is now retired and living alone after his wife passed away. He is fortunate to have a supportive daughter who lives close by and is able to help him. Vitals. Mr. Smith's vital signs include a heart rate of 80 beats per minute, a blood pressure of 144/92, and a respiratory rate of 12. Mr. Smith was admitted because of cancer of his bladder. He is 1 day post-op after coming in for a cystoscopy in order to see and get a better sense of his bladder cancer. He now has a suprapubic catheter, which is very bloody because of the surgery. Some other illnesses contributing to this general health and well-being are his diabetes, COPD, and heart problems that seem to run in the family. In 2000, he had a heart attack, and his father died from a heart attack many years ago. Review of systems number 1. The first system tested for the review of systems was cardiac, mainly because of his own and his family heart history. He reports no chest pain or numbness of the arm or jaw. He states that he had a heart attack in 2000 and that his dad died of a heart attack. He says that he thinks his blood pressure is normal and does not have any murmurs. He does not exercise anymore but gets tired if he has to walk up the stairs. He also says that he feels he can walk a good distance without getting distressed as far as the hallway, which is about 100 feet. When asked about difficulty lying down or needing pillows, he says that he does not lie down ever but prefers to be sitting so that he does not have to worry about pillow use. In conclusion, he stated that he thinks his heart beats just fine. Physical examination number 1. The cardiac assessment consists of inspection, palpation, and auscultation. When first inspecting, there were no signs of heaves or lifts anywhere on the chest. The contour of the chest was a little more barrel-chested than normal, but the two sides were symmetrical. Next, the palpations over the 5 main areas of the chest for lifts and throws were negative, as was the palpation over the PMI. Auscultation of the heart included the aortic area, the pulmonic area, Erb's point, the tricuspid area, the mitral area, and although these sounds were very faint and harder to hear, the actual sounds were normal. We listened to the heart sounds with both the diaphragm and the bell with patient lying down and sitting up. The mitral valve was also listened to for the S3, S4, and murmur sounds with the bell, but nothing was heard. Review of systems number 2. When answering questions about his respiratory system, he responds that his shortness of breath is limited because he does not do too much physical activity or exercise. He says that he has never had pneumonia, bronchitis, or asthma. He does cough sometimes, but there is no sputum production or infections. He says that he does not have any pain unless he becomes short of breath and does not think that he has wheezing. In response to questions about monthly breast exams, he replies that he has never done any of those. Physical assessment number 2. Just as with cardiac, respiratory exam involves the use of inspection, palpation, and auscultation. Upon inspection of the thorax, it was seen that his transverse diameter was fairly close to 1 to 2 and was symmetrical. There were no injuries on the chest, sides, or back, and his breathing rate and pattern looked normal. However, the depth was slightly deeper and looked a bit distressed. Upon palpation, the trachea was straight and in line, the expansion of breathing was symmetrical on each side, and there were no signs of tactile fremitus. Bones felt normal, although there was some subcutaneous tissue covering them. Auscultation included listening to the lung fields anteriorly, posteriorly, and laterally, at all of which wheezing was heard during expiration. Posterior bronchophony, posterior egophony, and whisper pectoriloquy were all normal. Pertinent system number 1. Peripheral vascular system is another system that may need to be assessed. According to Napa Valley at EDU, it is important to assess the PV system after a surgery because these wounds can become infected or harmed more than they already are. If not looked after, they could become an even bigger problem for the patient. It is also important to make sure that this wound or that his heart problem is not affecting any further blood flow to any part of the body. Pertinent system number 2. It may be important to do a neurological exam for a couple of reasons. According to Ohio State University's Medical Center's website, a neurological exam is needed in order to track a patient's progress in the hospital or with a certain disease. Because this patient is also on heavy medication for pain, it can be used to track the results in respect to that as well. Thank you.